According to the Center for Disease Control, in March, an unvaccinated 17-year-old contracted the measles while on a trip to London. Upon returning home to Brooklyn and getting diagnosed, the CDC had to notify 3,500 people in healthcare, school, and home settings. While the majority of these people had already been immunized against measles, there were 58 documented cases stemming from people the 17-year-old had come in contact with. Of those 58, 12 were under the age of 12 months, which is the minimum age required to receive the vaccination. And while measles had been considered eradicated in the United States back in 2000, this was the highest outbreak since 1996. Choosing to vaccinate would have stopped this from spreading. Health and medicine scholars consider public vaccination programs one of the top 10 achievements of public health in the 20th century. While the benefits of vaccinations are well documented, there are still those in the United States who refuse to immunize their children. Today I will talk about the importance of vaccinations and why you should get them. The CDC states that diseases such as measles, polio, and tetanus are at their lowest levels in history thanks to immunization programs required to get into kindergarten. The only way to gain immunity against the disease is to fight it off. This can be done in two ways. The first is through natural immunity, which is contracting disease and fighting through the illness. Unfortunately, this comes with the possibility of spreading it to others. The second is through vaccinating against the disease. According to the College of Physicians of Philadelphia, vaccines work by mimicking the disease and stimulating the body's immune system to create a defense against it. Vaccines, which provide artificially acquired immunity, are an easier and less risky way to gain immunity. Vaccines can prevent a disease from occurring in the first place rather than having to cure it after the fact. The CDC has a recommended vaccine schedule from birth. If followed, children will receive immunity to 14 diseases by the age of 2. This can be done in as few as 18 shots or as many as 26. The vaccine schedule is reviewed every year by the Advisory Committee for Vaccine Practices, or ACIP. They evaluate the combination of vaccines, add new ones, and update the schedule for immunizations. The ACIP is a committee composed of medicine scholars, physicians, and organizational representatives who are experts in the field of infectious disease and pediatrics. Childhood vaccinations are important not only to protect your children, but also to protect others. A question you are probably already asking is, if vaccines are so successful, why are you worried about my child spreading something? There are some vaccines that cannot be given until the age of a year, therefore they are susceptible to contracting disease within that first year. Vaccines may not be as effective for those with compromised immune systems. A family I know could not bring their baby to church due to the fact that he had a compromised immune system, and several large families refused to vaccinate their children. Also, vaccines are not completely 100% effective. Most childhood vaccines are 85 to 95% effective, and with exposure it is possible for the immunized person to receive a weakened version of the disease. Those who are not vaccinated are at the highest risk of severe complications such as hospitalization. Upon reviewing data used as a case against vaccines, I found reports to be quite coincidental. While vaccines can have side effects, most of them being mild, quite a few of them, such as fever and loss of appetite, can be explained by teething, which is also occurring in the time frame of vaccinations. The measles vaccination is also thought to cause autism due to two factors. First is that the injection is given between 12 and 18 months, which is the time when autism symptoms begin to show. Another is a study by Dr. Andrew Wakefield done in Britain. In the 1990s, Wakefield did a study of 12 children. His conclusion was that autism started to show between 12 and 18 months after receiving the MMR vaccine. His study was then published in the British medical journal The Lancet. But almost 20 years later, his The Sunday Times in Great Britain revealed that Dr. Wakefield had manipulated his data. The study was retracted, Wakefield lost his license, and the British Medical Journal did a three-part article titled Secrets of the MMR Scare, Exposing the Falsified Data. Since then, millions of dollars have been spent to try and recreate the study, but all attempts have been unsuccessful. As with any medical thing, there are always risks. No medication, not even Tylenol, is 100% safe or side effect free. The facts don't lie. All vaccine preventable diseases have declined significantly in countries with good immunization programs. Wherever vaccination rates are high, disease rates are low. According to the CDC, prior to 20th century vaccination programs, there were over 500,000 cases of measles per year in the United States compared to 55 in 2008, and 48,000 cases of smallpox compared to 0 in 2008. It is important to vaccinate because we do not know when or where we could be exposed. With the accessibility of travel nowadays, it's easy to spread disease from country to country just by boarding an airplane. In 2010, in Seattle, Washington, a passenger exposed passengers and other people at the airport to the measles. So do your research and the math and go to your doctor's office to get more information on preventing the spread of vaccine preventable diseases.